Okay, good. We're on for here. Hello everyone, Dr. Rich Castellano here, the Smile Doctor, double board certified facial plastic and reconstructive surgeon. We're here today with Linda. Linda, how are you doing?
I'm fine.
Very good. And we did some of the filler, the Latero filler, and now we're doing the ImageLift facelift so you can see in her before pictures. Thank you all for joining. Welcome. So you see in her pictures that the neck and the jawline she wanted to tighten. How long had you been thinking about doing the neck and jawline for, Linda?
About a month.
About a month. You're ready. When you make a decision, you're ready to go. And you had a chance to talk to some of our patients and see the before and after. So we're here today. It's so exciting that today is Linda's day. So what I'm going to do is we'll just do a little zoom in so you can see up close. We're on Facebook. We're also on YouTube, and we're also on Periscope. So thank you for watching. Thank you for sharing. Definitely let your friends know that you are watching live surgery. They're going to be upset if you tell them you're watching live surgery but didn't share so that they could. Here we go. Let me set this up here so that they could watch too. Perfect. Okay, good. And wonderful. So this, okay. And great. All right, I'm just gonna make one little adjustment here, and we'll get everything set up. So what we're gonna do is we've already given Linda some of the relaxing medicine, okay? And then after, perfect. Yeah, this one we're gonna redo. It changed on us, so we're gonna redo the broadcast for this. Very good. So we're on Periscope, we're on YouTube, and now we are just setting up for perfect. Okay. So we're in Tampa, Florida, and in the Villages, Florida. You can look us up at imagelift.com. Good. And I'm making one little adjustment because I love to just fuss over all the details. Yeah, once it gets going, it doesn't create any problems, but we just like to set it up correctly. Okay, good. And we're all set to go. Okay, so just one last time I'll show for the, there we go. Hello, Facebook, Dr. Rich Castellano here, and here we are back with Linda. We're gonna show, here's her before pictures one more time so you can see the neck and jawline before we make the dramatic transformation. So excited. So Linda, this morning we saw a bunch of our patients that came through and they had their results and they loved it. So we're really excited because your follow-up appointment's coming up soon and then we can take pictures of you and really, we love doing what we do and we have a lot of fun because we have the best patients and we have the best team, and that just makes it fun. I feel like I'm retired, I get to come to the office and do things we love to do and spend time with people we love to spend time with. And Linda knows the power of smile. She's a good smiler, so we always appreciate that in our patients. Very good. So my team has everything set up. This is all an office-based procedure, so you don't need to go to a hospital, you don't need to go to a surgery center for this type of procedure, and that's what patients prefer.
They were asking Linda if she's ready for her new change. Linda, you ready?
Yes.
She's ready. She's ready. We're ready. This is happening. Of course, we can't be held responsible for any behavior Linda gets involved in when she looks younger. But we know she'll behave. She's always got good behavior. Okay, so we've done the prep. We do the HIPAA cleanse on the face, and Charlene has laid out all of the sterile towel. I'm going to use some of the local anesthesia. That's 1% lidocaine with 1 to 100,000 epinephrine. And then we also have a tumescent solution made up of lactated ringers, bicarbonate, a little bit of epinephrine, and of course lidocaine. I'm going to hand this to you. Thank you.
You're welcome.
Okay, welcome. For those of you just tuning in, let us know where you're joining from. Are you in the United States or are you international? And what is your medical background? Are you medical, non-medical? We've had pilots, engineers, attorneys, stay-at-home parents watch. I'm just drawing on the chin here. And I go right into the submental crease, and then I use the alar base of the nose to make sure we're in the midline. Hello, Miami. Thank you for watching. This is the 1% lidocaine with 1 to 100,000 epinephrine. It's a 30 gauge needle and a 3 cc syringe. So you'll feel a little pinch here on 3. 1, 2, 3, pinch. You feel a big pinch, little pinch, not too bad?
Not bad.
Very good. Patients come to us because they want someone who specializes just in the face and neck. And it's very difficult to be as good as someone who does 10 or 20 times the volume of what another provider does if they do a lot of different things rather than focusing in one area. Hello, thank you for joining. Welcome. Hello, thank you for watching. This is the tumescent solution. Okay. Hello from Ohio. Say you're forcing your girlfriend to watch. Well, she doesn't have to watch. Pressure pinch. It's not for everyone to watch. Lindo, tell me what you're feeling there. Do you feel a little pinch or not too bad?
Not bad.
Hello and welcome. If you're just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon, doing a facelift under local anesthesia. A lot of people are unaware that you can do things this way. Hello and welcome. And that's why we're broadcasting. You used to have to go to the institution or the university to learn from the academicians pressure pinch. But now, through the power of my Verizon and AT&T plan, we have a global broadcasting resource. Yeah, we do use a bicarbonate. It sounds like you have a little bit of a medical background. Let us know what your medical background is. We've got surgeons and students watching. For the medical students and doctors watching, make sure you look up our practiceprofitabilitymd.com. We have our event. Yeah, local is far better. Thank you for sharing, everyone. We're doing a facelift under local anesthesia. So Practice Profitability MD is our ability to teach doctors how to take better care of their patients. We offer CE credit, and it's going to be here in the Tampa Convention Center, October 26th. So mark the calendar, October 26th, 2018. Hello, Dee Dee. Good to see you. Thank you for joining. Linda, how are you feeling, dear?
Okay.
Very good. Linda's tough. Try and make it easier than getting a tattoo.
Oh, they're talking about LeBron James.
Yeah, LeBron James. They're talking about LeBron. All right. Sidebar conversation. We're doing surgery here, so we're not talking about LeBron. And then, so the tumescent solution, you can see there's a little bit of swelling, and the epinephrine in the tumescent solution helps to reduce the bleeding. Thank you very much. Appreciate that. Hello, Pastora. Thank you for watching. Everything's looking good. So we are live broadcasting in 3 different areas. We're live broadcasting in Facebook, YouTube, and on Periscope. 3 different types of audiences. Proud to be able to use technology this way. I think LeBron's, is he going to go to the Lakers or where is he going to go? I don't know. We'll see. Let me turn your head this way just a little bit. And we'll do a little more numbing from behind the ear. Do you feel a little pinch there?
Little.
So as long as patients have little pinches like this, it's very tolerable.
Austin Boss is asking, is that normal? I'm not sure.
I don't know if it's normal for LeBron to get traded, which your question is. We're doing the tumescent solution here. So yes, it is normal to have the swelling, and then that goes away. Hello, if you're just now joining in, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon in Tampa and in the Villages, Florida. Make sure you look us up at ImageLift.com. Check out our Facebook page, facebook.com/ImageLift. We do seminars on a regular basis. We're going to be in Las Vegas at the Aesthetic Show to do some teaching. Haha. I'm pretty sure LeBron is not watching. He's got other things to do. All right. Everything's looking good. Wonderful. Hello, and thank you for joining. So, when they used to do facelifts, it was done under local anesthesia to start with, and they started out with skin-only facelifts, which worked, but they just didn't last as long, and the results were not as good. So now we do a different type of facelift where we tighten, LeBron's in Miami, where we tighten the muscle layer, and you get better results. They look more natural. Linda, how you feeling, dear?
Okay.
Hello, Liz. Thank you for watching. Bruce, you can stand over here if you'd like. It's up to you. And we have one of our students is visiting today as well. A lot of the students coming from USF College of Medicine. So excited. The future of medicine is here. Let me turn your head this way a little bit and a little bit more. Is that okay for you like that, Linda?
Mm-hmm.
So a little more numbing through here. Thank you for watching. Thank you for sharing. Lots of hearts and shares for Linda because she was so kind to allow us to use the teaching video.
So what ratio are you using?
Yeah, it's around 250 cc's of tumescent solution. We put 25 cc's of 1% lidocaine with 1 to 100,000 epinephrine, and then there's bicarbonate that we add as well. So it's a pretty standard tumescent solution.
And someone asked what happened.
We're doing numbing medicine, so that way when we do the lift, she can't feel what we're doing. Thank you for watching. Thank you for sharing. We're in Tampa and the Villages, Florida. Can you hit the button for me, please? Linda, how are you feeling?
Fine.
Everything's looking good. We normally, after the lift, will see patients 1 day, 1 week, 1 month. We do mix our tumescent solution. So, Nina, can we turn the AC a little cooler, please?
Mhm.
Thank you. So proud of our team. I could not do this without our team, Charlene and Nina and Ari. Of course, now we have Sean and Courtney, Mindy, Stephanie,
Have you worked on
Violet.
celebrities before?
Of course, absolutely. We're in Tampa, 3314 Henderson Boulevard in South Tampa. Yeah, we have a lot of celebrities that come through and they want their privacy. One of the rock stars came through. We were listening to his music when we were doing his procedure. It was a lot of fun. But that's the nature of the world today, is that as we're living longer, people want to look younger, and in the music industry and all of the media, celebrity industry, we got to keep up with our appearance. Okay, I'm going to turn your head all the way to the middle now, nice and easy. No, we can't say their name, that's correct. Everything's looking good. So now that I've done the tumescent solution, now I'm going to use the 27 gauge. We use 1% lidocaine. Yeah, can you open your eyes up for me, Linda? How are you doing? Yeah, she can
Fine.
open up her eyes, and you can keep them closed too, that's fine. You can relax. If she drifts to sleep, we'll wake her up when she's done. Some patients ask for a little more relaxing medicine. Some say, yeah, it's no problem. It's like you feel you had a few cocktails. But Linda's pretty easygoing to begin with. Let me turn your head this way a little bit. Yeah, it's the safest way to do things. So now this is where I'm going to make the incision. So I use a little bit extra lidocaine, 1% lidocaine with 1 to 100,000 epinephrine.
Will the wrinkles go away?
They never go away 100%, but we want to improve them as much as possible.
Is she in pain?
Are you feeling any pain, Linda?
No.
She says no. I believe her.
Oh.
Some people will say, you feel a little pinch there?
No.
Some say, oh, it looks so painful, but I just ask the patient. If they feel pain, I will treat it. If they feel a pinch, I do a little bit of numbing medicine, then they don't feel anything. She might feel a little pinching there. And so I'm just doing a little extra. Yeah, Liz, if you want to make an appointment, you can give us a call, 813-463-9245, or private message your information, and we'll give you a call, 813-463-9245. Schedule's pretty busy, so make sure you call in soon because I'm pretty booked up. And I'm going to use my little marker. Yeah, most patients say we're easier than the dentist's office. So if you don't do well at the dentist, you still would do well with what we do. Very good. Thank you for the hearts and thank you for the shares. I appreciate that. So this is the area that I'm going to undermine out through here. Now, Linda, I'm going to turn your head all the way this way and then a little bit more for me, please. Thank you very much. So I'm going to draw again in the areas where I'm making the incision line. The incision line hides nicely in the hairline, in the post-tragal and pre-tragal creases. The traditional facelifts used to make this area of hair go away, which is not a good thing. We preserve that now. Yeah, people ask if this is covered by insurance. The only insurance that we accept is a Visa, MasterCard, and American Express. So it's not covered by insurance. It's cosmetic elective procedure. Thank you for your question. Everything's looking good. Perfect. So numbing medicine across the incision line. So to be healed, there's physical versus social downtime after the lift. Physically, we get back into our routine, errands, shopping, things around the house within a day or two. Not 100%, but you start your routine. Socially, we pass the grocery store test. 7 to 10 days. You walk into the grocery, nobody really does a double take. Now some take a little longer, some are a little less. So there's still some mild healing that goes on behind the scenes that you may feel but not necessarily see.
Someone asked about the pricing.
You can go to imagelift.com/pricing, and all the pricing is there. Let me have you turn your chin all the way up. imagelift.com/pricing. Thank you very much. 15. So, can you turn the laser on? So, Linda, we're going to do the laser part, and your job is just keep your eyes closed. We'll put these little eye shields over top, and then when I make the incision, this area here. And then just don't touch anything on the top of the tray, it's fine. Okay, you can turn the laser on, please. So we make the incision point here. Perfect. And here. Great. So here are the little eye shields. So your job is keep your eyes closed, number one. Number two, the eye shields are a second layer of protection. And number three, I only activate the laser when it's in a safe place to do so. Everything's looking good. And then I use the bipolar cautery, which uses electricity to create a current that cauterizes the blood vessels. You feel a little pinch there?
Mm-hmm.
So she felt a little pinch, so I'm going to do a little more numbing in that area. Thank you for watching. Thank you for tuning in. For those of you just joining, I am Dr. Rich Castellano, board certified facial plastic and reconstructive surgeon. Tampa, Florida, and in the Villages, Florida. We'll be at the Aesthetic Show. Go to aestheticshow.com. And we will be presenting, doing 4 different lectures on how to do the fillers, how to build your business. A lot of doctors are very good at what they do, but they don't know how to run the office. So we help them with that. We show them, here's what we do in our office. Here's what works for us. Very good. So as you can see, there's really minimal bleeding from a procedure like this. There's some of the fatty tissue. Okay. So now, once we've elevated that area, then I use the laser lipolysis. Perfect. You can grab it right here. Thank you. So this is the helium neon guiding beam right here. Okay, and then it's an ND YAG laser. This is the 1064-1320 wavelength. And when I step on the pedal, you hear the little popping noise, and that's the laser delivering. And you hear this, the fat cells that are that are getting destroyed from the heat energy. And they call it the photoacoustic effect, which you hear the noise. and it warms up the tissue. So we monitor the whole process by I feel the temperature, number one, in touching the skin. We monitor the temperature externally. Of course, I monitor it visually as well. And then we have an external thermometer here where I can even measure the temperature, and Charlene's got that. So all of those parameters allow us to have a safe treatment and deliver the correct amount of energy. And the energy, it removes some of the fatty tissue. It also causes a thermal injury to the undersurface of the skin. And then it causes a little bit of hemostasis by closing some of the blood vessels underneath. So all of those help us to elevate the skin, and we lose the elasticity in our skin. It's like the elastic band or the old sock that gets stretched out. It doesn't fit so well anymore. So we're just kind of painting. These are my Bob Ross moments, you know, little fluffy clouds and just painting away the little fatty cells.
What's the threshold for temperature?
So tissue gets destroyed at 42 degrees centigrade. So you obviously want to stay below that now for the full thickness of the skin. But at the surface of the skin, you might have a little bit of damage, so it's a little hotter at that point. But where we measure it through the layers of skin, we keep the overall temperature of skin below 40 degrees centigrade. Everything's looking good. Thank you for inviting your followers. Appreciate that. And that is an important number to know, because in hospitals and operating rooms, they heat up the fluids in many cases. And sometimes those warmers, if they are heated up above 42 degrees, you know automatically, it's at centigrade, you're going to create a burn. You're going to damage the skin. So I'll never forget, when I was in medical school, one of the plastic surgeons came out, he said, you see this warmer, you see what it's set at? It was set at like 39 degrees. 39. It's like there was a time a patient got a burn in the hospital because the thing was set at 45 degrees. You know, someone didn't know. That's the limit. So we keep it well below that. You want to create a controlled injury. Surgery is about a controlled injury. Hello, Wanda. Thanks for joining. Perfect. I'm going to do a little bit of cautery here for this area. You feel a little pinch there?
A little.
She feels a tiny pinch there. Everything's looking good. How about over here? A little bit of a pinch here or not really?
Mm-mm.
Very good. Thank you for tuning in. How about there? A little pinch or not really?
Nope.
So the lidocaine works amazingly well. Patients usually feel nothing, but if they feel a little something, then I numb. And then after that, if I numb a little more, they just don't feel it. So I'm going to go back to the laser treatment. Temperature, please, Sean. Get the temperature reading from the side, from right where you are, from exactly where you are. Can you do that now? Thank you. So I'm just elevating the skin, the highest that you can. Everything is looking good. Okay, great. And people talk about the video. They say, well, is that a distraction to do the video? Actually, it helps in that I'm just describing what I'm doing, number one. But when you're on video, it certainly raises your attention. Patients will say, well, boy, if he's live broadcasting, he's going to do a great job, because he wants to make sure you don't want to do something you're not supposed to do on camera. So my brain says the same thing. I'm going to do a great job, whether or not we're on live video. But it does raise your awareness. It does give you, it's fun to teach, but patients enjoy hearing me talk. They say, well, I would not have thought to ask that question. And they like hearing my voice. When they hear me talking, they know everything's going just fine. And it's not an emergency procedure. I can just pause at any time and restart. So for these types of procedures, it's a perfect way to educate, to train, and sometimes patients watch their own videos. Now, Linda, do you think you'll watch your own video or not really?
Do I think I am?
Yeah, will you watch your own video when you're done?
I will.
So Linda's gonna watch her video, and I think that's very educational. So good for her that she can watch her video. You don't have that opportunity for all surgical procedures that go on. I know when we had, my kids were born, my daughter born in Indianapolis, I did videotape that, but then my boys who were born here in Florida, they wouldn't let us video. So, you know, I didn't want to fight with the doctor right while he's delivering my baby, so I just said, whatever you need, you can have it. Yeah, they're not bothering Linda. Linda, how are you feeling, dear?
Good.
She's doing great. They're very grateful that they can watch your procedure, and it's helping them to learn, and it's enjoyable to see. It's entertaining. You know, human anatomy is really fascinating, and human body is fascinating. That's why I love to be a physician. But the best part about what we do is the people that we get to spend time with. Patients like Linda. We've got an amazing team. We love our students that come through. I mean, this really is just a lot of fun. Everything's looking good. Perfect. Okay. So after we're done with the laser, we'll do some stitching and tightening. So this thermal contracture happens over a period of about 6 months. Everything's looking good. If you're just now tuning in, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We will be rebroadcasting later, so make sure that you are following either at ImageLift or Periscope, Facebook, YouTube. Very good. Perfect. Over here, so I can already see that there's some contouring of the neck and jawline just with what we're doing. It breaks up some of the fatty tissue cells. The tightening effect does take a little bit more time just yet. So you do see some results, and then this helps us to elevate the skin. Everything's looking good. Someone asked our favorite music. Well, you know, we listen to different music. When I'm doing the teaching videos, I don't put music on because we don't own that content, so I don't want our videos to be blocked. All music is good. Music is great. Everything's looking good. Okay, so we're done with the laser now. I'm going to set this over here. Perfect. And now what I do is I use, these are the cons scissors, the cons that allow me to elevate the skin. I use both right and left hand. Let them know that. It's like playing the piano. You get used to using both hands when you do enough of these procedures. So you don't need the goggles at this point. So I'm just elevating the skin. Linda, how are you feeling, dear?
Okay.
And I can see some of the fatty tissue. We will be doing some tightening stitches around the platysma muscle. If you flex your neck muscles and you see the little band that comes out in your neck, that's the platysma. And when we stitch that together, it gives a lot more contour to the neck and jawline. Now there are some doctors, what they do is they remove muscles and glands from the neck and jawline. And so they do that for contouring. I just don't recommend that. Most of my patients don't want that. Thank you, Nina. Great job. So again, patients find us because they want less is more. They want a natural result. We have people from all walks of life come through, media personalities, other physicians, stay-at-home parents, realtors, engineers, you name it. People come through because we are treated differently based on our appearance. Very good. So elevating the skin here. Oh yes, still playing the guitar, absolutely. We love to have fun with the guitar. It's very peaceful. That's Crystal. Good to see you, Crystal. And we used to have a Crystal that worked here. I don't know if that's the same Crystal or not. A different name. But yes, we still do play the guitar. It's a good thing. I gotta keep my hands busy, you know. Alright, so we're elevating the skin. Now I switched hands to the right because it's just easier on this side, on this angle. Everything's looking good. Thank you for watching. Thank you for tuning in. We will be rebroadcasting later, so make sure that you are following. Oh, hey, Crystal. Okay, good to see you. You changed your name. All right, you can only see the little thumbnail. Hope you are doing well. And Brock and everyone. All right. Thanks for joining. Now, all right. Okay, can you expose for me, please? Thank you. So then I use my gauze for visualization. Yeah, there's no restrictions on what we eat or drink afterwards. It's not like surgery where you have to be NPO or you cannot eat anything. So that's the benefit too of doing it under local anesthesia. Everything's looking good. Thank you for watching. Thank you for tuning in. So now I'm going to grab some of the little fatty tissue that's here. You can see just a little tiny bit of that, and I'm going to trim. And so you can see the tissue, right? I figured she didn't want that anymore. Linda, how are you doing, dear?
Fine.
Everything's looking good. So I just trim a little here. We did the laser lipolysis that gets rid of some of the fat cells, and now I'm doing liposculpture where I'm just directly removing the fatty tissue. And we just do everything one step at a time, and before you know it, you cross the finish line. I'm very proud of the way things look so far. It's looking great, and we expect things to go very well, of course. We had the discussion ahead of time with Linda about setting the right expectation and making sure, you know, I can't make things perfect, or I never use the words gone, take away, get rid of, but we do give significant improvement. And you must look natural. That's so important, because too many people that have done cosmetic treatments, they don't look natural. And if you, and that's what people are looking for. Very good. Now, Linda mentioned before, she's 72 years young. Did I remember that correctly, Linda? Yeah, and she's got many active years ahead of her, so we're very proud. Hello, thanks for tuning in. Thanks for watching. Thank you for inviting your friends. If you're on iPhone, you can swipe left or right and invite. If you're on Android, you swipe up or down. Okay, perfect. Doing a little cautery to the blood vessels on the undersurface of the skin. On this side for me, please. Very good. Thank you for tuning in. All right. A little bit more of the fatty tissue here. So liposculpting now. And what you do for the physicians and students that are watching, if you grab the traction, counter traction, I grab the fat, and as I draw it up, then I can just very easily trim it away. So this is under the angle of the mandible, as we call it. That's the anatomical feature we use to describe. Perfect. If you have questions, you can give us a call, 813-463-9245. Go to our website. Thank you for tuning in. All right. We will be rebroadcasting later, so make sure you are following. I'm going to do a little bit of cautery on this side. Very good. Linda, how are you feeling? Perfect. So now, when you're lifting the skin to do a facelift correctly and to do it well, you just look for the individual tiny blood vessel and they get cauterized so that you don't create a fluid collection later. I mean, even if you do create a fluid collection later, you can treat it, but we try to avoid that. So you always look in surgery what both hands are doing. There's the traction and counter traction. So one hand is working here, and then my fingers are working over here. And so now that I've removed some of the fatty tissue, I'm going to be doing some suturing. I like to use the 2O Merceline. So you see the suture here that we're using. And everything's looking good. All right. Perfect. So now when I place this first stitch, I'm going to do a running stitch down the rest of the platysma muscle. And I like to reinforce that. So let's see. Okay. Now the platysmoplasty helps to really tighten the neck profile and jawline. Hello, thank you for joining. If you're just now tuning in, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. So this is a running interlocking suture for the platysmoplasty. Perfect. And you can see on the skin where it's a little bit lighter here and a little darker here, that's from the epinephrine causing the skin to blanch. That shows less blood flow here because of the epinephrine, and that helps the lidocaine to stay in the area longer. That's desirable. Do you feel a pinch there?
Mm-mm.
Are you feeling any discomfort at all?
Not really.
So we expect Linda to feel pressure, but she should not feel any pain at all. Pressure is normal, but no pain is she should be feeling. And if she does feel a pinch, then I'll do a little bit more numbing, and then she shouldn't feel anything after that. Very good. Okay. So just stitching the edges of the platysma muscle together. I remove a little bit of the subplatysmal fat, not too much. You don't want to, you can hollow the area out, and there's a name for that. They call it the cobra deformity, which, you know, some names in plastic surgery just should not be repeated. I mean, nobody ever wants to be known as having what they call a cobra deformity, but I suppose we do need terminology so that we can describe it amongst ourselves. But there are some doctors that will share that with the patients, but you don't want a patient ever thinking they've got that. So the good news is we'll never let that happen to Linda. Thank you. Just on the little sartan. Okay, 1 or 2 is fine. We'll decide. Thank you.
Thank you.
Thank you so much.
You are welcome.
Very good. So we've got your comments. We broadcast them up on our little jumbotron on the video monitor so we can see. Appreciate you watching. We've had doctors from all over the world view our procedures. It's interesting, when we first started with Periscope, that Periscope had the most live viewers, and Facebook caught up, so it's definitely more on Facebook than there is on Periscope. But Periscope still has quite a few people there, and we've had thousands of views even recently on Periscope, live and replay views. Everything's looking good. How are you feeling, Linda?
Fine.
Perfect. Interesting article came out, showed that people, based on their smartphone usage, only tend to visit about 25 locations at a time at any period in their life, which makes sense because we have the same places we tend to go to. But if we start going to a new place, what they found is that one of the older ones falls off. So that makes sense that people in general only have about 25 places that we usually visit on a regular basis. To me, that's fascinating. It shows how we're creatures of habit. So now I'm doing the suture. Perfect. Very good. So we've done the platysmoplasty. Now I'm going to start doing the other side of the lift, part of the lift, in just a moment. Okay. Release for me, please. So you can already see the contouring in her neck and jawline here. But as I say, you don't want to taste the chocolate cake before it's done baking. Exposure right here. You can see a little pinching into the skin tissue right here, so I will release that by undermining, and then you can see, now release for me, please. That's much more smooth and continuous. Now we're going to work from this side and tighten in through here, this side here, but I really like what I see. Great definition of the jawline, tightened across the neckline here. This is the thyroid cartilage and the cricoid cartilage. So one more look just to make sure it's the way I like it to be. Very good. Okay. So now we are going to rebroadcast, so thank you all for watching. Thank you for tuning in, and we'll see you in a little bit while we get set up to do the next side. And just to show you, you see her profile there, and now you can see from where she started what a